And good morning. Welcome back. It is time for CBD with your favorite PhD. Good morning, Dr. Kat. Thanks for joining us as always.
Good morning, Carmen.
How was your weekend?
It was great. Thank you. I really enjoyed having Sunday to look at the sun.
Good, good. Well, I know that yesterday was the last day of the Green Plant Summit that you were a part of. Really quickly, would you like to review with everyone of some of the new things that you yourself have picked up on from the summit?
The summit was amazing. I think most of you saw me posting some of the people that were there. And I thought it was so important because even though we research and we present and we're on top of CBD, it provides a deeper layer and a different perspective. And I saw that we all had the same things in common, but the new research is coming out in various areas. They covered almost every part of the body, the uses of CBD to include legalities, traveling, sports medicine. Even though the summit is over, we'll talk about how to get a VIP pass because it's not going to last long. But with a VIP pass, you can hold on to the summit. It's 8 speakers a day, 4 hours a day. You're going to learn a lot about your body. You're going to learn about natural health. When the doctor was talking about pain, they talk about pain receptors, neuropathy. When the doctor was talking about immune health, she was talking about how our immune system works. And then they would add the component of the CBD. So I learned, it was a refresher in biology 101. With it's sped up 1,000 times forward because from when I took biology in school, so many advances have happened in the body. So I loved listening to the professions. And not only that, there were people who are doing amazing things, creating businesses through CBD and giving back to the community. The industry, was evident in this summit. And I loved seeing it. I love the good things that they're doing with the CBD and also being very careful and ethical and teaching that out to other people. Because as we've spoken, there's a difference between CBD, cannabinoids, the hemp CBD we're talking about, and marijuana. And they spoke about both, which was really interesting. That was the one thing that I really enjoyed is the differentiation with CBD and THC. And I've presented, and you presented with me as well, the difference between CBD and THC. The one thing that I liked a lot, a few pointers I'm going to share with you that I liked and I wanted to remember and share is that we know about antioxidants. They have been very well studied. Everybody gets their vitamins A, C, and E, and want to make sure that there's no free radicals in their body. Well, it was reported that CBD is a stronger antioxidant. Not to not take those vitamins because they all have a different role in the body, but the fact that it's a strong antioxidant to have that extra coverage to remove, the toxins from the body, the free radicals, things that don't belong in our body.
Wow, that's incredible.
Yeah, I loved that. And, just to hear it simply. And by the way, the summit is in as simple terms where the layman who doesn't know, the medical terminology will be able to understand it because there were so many stories. People told their stories. The other thing that was emphasized throughout so many speakers was the immune system, how CBD helps the immune system. It brings balance to our body through our endocannabinoid system, and how it's important during these days with COVID in the winter months. But overall, they talked about, they didn't spend too much time about the COVID, but they talked about overall our health, autoimmune. So if you have an autoimmune disease, if you have any disease, I highly recommend getting the VIP. We are not selling anything.
It's
We are
education.
educating. Absolutely. And if anybody knows Carmen and myself, you know that we have a passion to educate the community to do well. And it's very rewarding on our end to see good things happen. And so that's our motivational drive.
Right.
Um, the other area they talked about, which I found fascinating, is the legalities of CBD and THC. And you have to watch this because they made very distinct, beautiful examples. The person who presented talked about each state, imagine it having a wall,
Right.
and how to travel through that wall. The metaphors were very, very nice. The one thing that stood out was that putting CBD in food, like pizza or in Coca-Cola, and advertising it and selling it is still illegal. And the thing is that there is no regulated body to go right now and say, don't do it. However, as a supplement, as we have been using it, tinctures, topicals, capsules, it is legal across the whole United States. But they also said that you have to check your jurisdiction. And if you're traveling, always go and look at the health department on your website to find out, because that's a question we get at the practice all the time.
Sure.
Can
Sure.
I travel? Can I cross borders with the CBD? I loved listening to the attorney
Sure.
who represents cannabis and CBD clients, and also is an advocate for CBD, which was wonderful. And then the biggest, most wonderful thing, we've always been very, very careful. We do the lab work. We have people do lab work when they come in, when we do a consultation or an evaluation. We look at people's medicines to make sure there's no contraindication. And we've been told the way that CBD metabolizes in the liver is similar to, it goes through the same pathway that some cholesterol medicines go and other medicines. And we've been making the analogy that if you can't take grapefruit, then we need to either talk to your doctor, see if you can reduce the medicine you're on or change it, or always communicate with your doctor for sure, no matter what. We've said that
Because
so many times.
grapefruit doesn't, there.
They metabolize through the same pathway, so they all compete to go down the same pathway. Well, one of the presenters, one of the physicians, said that what they've seen is that with grapefruit, it plugs up that pathway, so the medicine can't go through. Even though CBD goes down the same pathway, it does not plug it up.
Got it.
So now, people can take CBD with those medicines we thought they couldn't. I thought that was wonderful. Now there's
That's
still
a
more.
revelation. That's quite a
Yeah,
revelation.
yes, it's
Sure.
huge. And there needs to be more research. We definitely need to talk to our doctors, let them know that we're on CBD. They can consult with us, bring up the research. I just did a presentation to some physicians, and after I finished, the first thing they said, send us the PDF of the articles.
Right.
So, they wanted to know, and they want to know this research. So
Sure.
that was very exciting. I
Great.
think knowing that. The other exciting thing was on heart disease. Carmen, how many times have we talked about how CBD was used to treat heart disease prior to the 1930s, right?
Right.
And so
Correct.
they had a cardiologist, somebody who spoke about heart disease. Dr. Joseph, was it Robos? Sorry, doctor. We'll get that. We'll give you the link at the end so you can go and look at all the presenters. But what he said is that the heart has CB1 and CB2 receptors. The receptors are the ECS, the endocannabinoid receptors. Well, the heart has both.
Interesting.
I know.
That's really interesting.
I mean,
A
it's just,
lot of new information that it's really, really critical.
yes.
So this
Yes.
is wonderful. So thank you for that summary because I think that that sort of helps to
I have
encapsulate.
one more.
Oh, okay.
This is very, very important. Two very important things because it goes with everything that we've been saying.
Uh-huh.
Sorry, Carmen. I know I kind of
Mhm.
stopped there, but they say that many people, we say CBD is not for everybody, but they said at the presentation that many people use CBD, but maybe stop too early, or they don't know how to dose it, or they're getting products that have no CBD in there because they're not labeled. They said that usually it can take 5 to 15 days for the CBD to start taking in effect. It depends on your endocannabinoid system. For some people, they may feel it right away, but
Right.
the majority of the people, 5 to 15 days, they take a little bit, they take the wrong thing, and they couldn't emphasize enough. With the mom and pops, many people have their fingers in CBD. They have good interest, but their mom and pops, they don't have the money to spend on the third party testing. There are people who want their fingers in the cookie jar because we've talked about how it's a multi-billion-dollar industry.
Right.
And so it's got to be vetted out. And that's what we do at Insight Wellness Center. That's why we carry your product, Bourbon, because you did that as a responsible manufacturer. And I only work with people that I know the manufacturers because they
Exactly.
said over and over again, unless it's got a label on it with a barcode, it's third party tested, it's full spectrum. They talked about, how to vet it out. And
Right.
how do you vet it out? Because at the dispensary, it'll be hard. It's overwhelming. On the internet, there's so many people selling. And to go to your health professional like ourselves to get your
Right.
CBD,
Exactly.
so that was so important.
Right.
And let's see. I think that was it. There were a couple other things
Okay.
but I know we have limited time. But it's
Well,
exciting.
yes, it is absolutely exciting. But also, we wanted to cover today because I think this is part of also the different people that you had presenting in this summit. There were CBD educators like myself, CBD therapists like yourself, but there's also CBD advocates. So I thought that might be really helpful, especially if someone's going to tune into the summit or just on their educational, their hemp CBD educational journey. Could you define for us the differences between each of these categories, educator, therapist, and advocate?
I would love to, and it's a perfect question. On top of all of that, there were physicians who don't label themselves in the CBD world, right? They
Right,
just
of
use
course.
it along with their practice, just like how I had started. I had started using CBD several years ago in my practice, along with an evaluation to see about people's vitamin B, vitamin D, their iron level, their thyroid. And knowing that CBD helped with depression or anxiety or pain and sleep, I incorporate it into my practice. But as we started learning more and more about CBD, we started having a lot of these titles that started to pop up. And very important because this is an area, if you think of aspirin, you think of morphine, you think of these amazing things that were discoveries, I put CBD in that category. And so it requires its own field, its own study, and its own professionals, along with the ancillary professionals. So we have the CBD advocate, and that is it's interchangeable, but it's similar to a consultant.
Right.
It may be somebody who is not licensed or have a medical degree or healthcare degree, but they're advocating, they're working with a company, they've been educated, and they're able to assist, but they also promote the wellness in the CBD.
Right. Right.
Then you have the consultant, and we have the consultants at the office
Right.
who are healthcare professionals, and they evaluate your needs. Say you come in for pain or because you can't sleep or arthritis or
Right.
Parkinson's disease. They look at the labs, they look at the medicines, and they make recommendations and monitor the dose. Then you have the therapist. Like myself, I do all of the above only because I started 20 years ago, and people come to me for whatever, but I like to label myself as the therapist because people come in with a medical issue,
Right.
and doing a very thorough psychosocial evaluation, doing a complete review of the labs, collaborating with the doctors, and then dosing, and monitoring and working with the person during that course of the time to bring about change. Sometimes it happens through psychotherapy where we can actually see what's going on. So, we can't use the word cure or treat. I like to use the word therapeutic.
Therapeutic. Yep.
I think I froze. Okay. Uh, yeah. And then we have the educator. It's what we are doing here today. It's who you are, Carmen. And the educator is somebody who is on podcasts. It's out in the masses, goes out and presents. They're speakers. They write in magazines. They want to educate the community, and they're usually hired or work to present. John Malanka has several titles. He was
Right.
the host, just like
Right.
yourself,
Exactly.
and he's an educator. He has a website called United Patients Group, where you can get all the resources that you need to learn about CBD, because he's educating people.
Exactly.
Carmen, you tell us about your role as the educator.
Well, it's just what you said. It's really supporting you, supporting others in the field, working with others in the field, keeping up on the latest information. And I want to emphasize again, we had a comment here from Ira. I believe he thinks that we're talking about THC and cannabis, and so I just want to make sure that in every presentation that I'm in, my area that I focus on is on hemp CBD. For many reasons, for me, one of them is I'm allergic to THC, and that's part of the education. This gentleman, Ira, says on one of the comments he addressed here that what we're talking about, that doesn't apply to the area that we focus on, which is
What is the question?
he just said varying degrees of stonedness, which I don't know if he's trying to be
Well, no,
funny.
I think that's
So
very important to bring up,
yeah,
because that was
exactly.
at the summit. And thank you,
Yeah,
Iris. Is it Ira?
Ira.
Ira, thank you so much, because
Exactly.
hemp CBD is not a psychedelic. It doesn't make you high, but there are some people who, and they said this at the summit, that they may put it down because, and I've seen it. They say to me in the practice that I took it and I don't feel anything. So when people have used marijuana, and they get the feeling, the buzz, that comes along with it. They think that they may get that with hemp CBDs, and when they don't, they think it doesn't work. So you're
Exactly.
not going to get that stoned feeling.
Right.
You may get focused if you use it in the morning. You'll get relaxed because it calms down, and the cardiac information about how it calms down your
Yeah.
system but keeps you alert. If you're sleeping and you're alert and your adrenaline is up, you're not going to sleep. But when the heart relaxes and the cortisol, they talked about that, goes
Yeah.
down, and then you can have your thoughts but drift off to sleep.
Sure.
Some people, side effects might be a little sleepiness, but that may be that they need a little bit less or a little bit more.
Well,
So that's what we do. So I think it's a perfect question, because we are talking about cannabinoids. There are over 140. I think they said 144. It used to be 100, that are being studied, and there's CBD, cannabidiol. We have CBDA, CBDB, CBDG, and the list goes on. And it's very, very exciting. The THC component is only zero point 0 to zero point 0.03 in the hemp CBD plant. The other point that they made that's very important, and again, thank you for this question, is that if you're working for a company that doesn't tolerate any CBD, even the legal level, which is what is in the over-the-counter supplement hemp CBD that we're talking about. Now, over-the-counter through professionals, it just means
right.
you don't need a prescription.
Right.
That there's broad spectrum. It has everything else, but they go in and they pull out any traces of THC. And we carry that also because we have police officers and nurses and so forth who want to benefit from that. Great question.
Right. No, and I think again, it's what we do in our presentations. We were talking about what is an educator, and that's exactly it's
Right.
addressing those questions and giving people information that they may have already heard, but they didn't quite understand. Whatever that is, it's just again for what I do, it's just focused on hemp CBD. That's my arena. That's where I focus on personally. So that's it.
Yes, and that's what we do at the office also. We're talking about hemp CBD. And the reason it's called hemp CBD is because of how much THC or no THC it has in it.
Right, right, correct. And that's not to say, of course, right? There's different people have different needs, and so for someone in another situation or specific situation, they may need the cannabis with the THC and the CBD combination, and that's why we have CBD therapists. That's why we have all this momentum in the educational area of this industry, and it's
Right.
so important. It's
And
so
we're not saying don't use THC, right?
correct.
Right,
It
because
just
THC
depends.
has its value and it's being studied, and it was studied first because of the marijuana, that was prevalent until the CBD started to get the limelight, and they started to realize that it has over 80% of the benefits. But some people talk about whole plant, but hemp CBD is a whole plant. Carmen, don't stress me out.
That's very good. Well, I think that's it. We probably should just mention to where people can connect with you, Dr. Kat, because you've got other CBD educators and your team at your wellness center. So I think just to let everyone know how they can connect with you personally, that would be great.
Okay, so first I'd like to remind everybody that there's going to be a link to the summit to get VIP. I think, Carmen, you have that and you can embed it.
If you just put it in the chat afterwards in the
Okay,
thread.
I'll do that. I'll put it
Yeah,
in the chat,
perfect.
so look for it. I'll
Yeah.
also put in the 20% discount that we're offering for the Bourbon, which
Oh,
is a herbal serum, which is organic CBD and Damascus rose. And I always say, I'll keep it in my purse for my neck,
right.
in between my fingers. It's very easy to apply. It smells good. Just the scent itself is an essential oil, and that has its terpene benefits, which is another show. And
Right.
then the other new product is the Aspen Green.
Mhm.
There we go.
Okay.
And that's an organic CBD as well. And we're offering 20% for people to try it, and for listening in on us, and for jumping in on the summit. The way you can reach us is through our website. It's insightforwellness.com, INSIGHTFOR wellness.com. And our phone number, 925-216-3510. Call, ask questions. There is no silly question. I mean, all the questions are so important. You'd be so surprised what we get asked, and they all have answers.
Exactly. That's what we're trying to do is help to educate and answer the questions. We have a limited time here, but you can always contact Dr. Kat and her team at Insight Wellness Center in San Ramon. Next week, we are going to do our season wrap up. We'll sort of review all the different, or as many of the different topics, and we will wrap up for the year for 2020, and we will figure out what's next in 2021.
Yes, we will. It's very exciting, and there's a
All
lot
right.
to review next week.
That's right. That's right. All right, everyone. Thank you so much for tuning in. We hope that you are getting the hemp CBD education that you're craving, and we will see you next week for our end of the season finale. All right. Bye bye. Thank you,
Bye,
Dr. Kim.
everybody. Thanks, Carmen.
Bye.